In today's world, when we think of deadly pandemics, we mostly think of viruses. After all, thanks to antibiotics and modern medicine, bacterial infections are usually well managed. However, due to the lack of antibiotics and an accurate understanding of epidemiology, that has not always been the case. One of the most devastating and deadly organisms in history was a bacteria, and it claimed the life of nearly half of the European population of that time. The bubonic plague resulted in the type of catastrophic loss of life that inspired art and literature and is remembered centuries after it occurred. When looking at historical plagues, the plagues of the bubonic plague are unparalleled in human history. The devastating loss of life began with the plague of Justinian between 541 to 542 AD. The estimated death toll was between 25 to 100 million, with the majority of the estimates being 50 million. The second pandemic of bubonic plague occurred between 1346 and 1353 AD, called the Black Death, and was estimated to claim between 75 and 200 million lives, with 200 million being the most common estimate. The total estimates of the death toll between both plagues was 100 million on the low end and 300 million on the high end, though most sources agree the estimate is around 250 million total. While these pandemics were worldwide, Europe and Asia were devastated by them. During the Black Death, 40,000 dogs and 200,000 cats were killed because they were believed to carry the plague. Since the fleas on the rats were the actual carrier and the cats and the dogs were natural predators of the rats, this worsened the problem. The organism responsible for bubonic plague is a bacteria called Yersinia pestis. The mode of transmission is initially flea to human via a bite, but later it can be transmitted human to human through contact of contaminated articles in the infected human and air droplet. The incubation period is 1 to 7 days. There are 3 types of bubonic plague. The most common is called bubonic, and it's when the organism affects the lymphatic system. It's characterized by swelling and buboes, which can later fill with pus and turn black, which is where the name Black Death came from. Usually, the swelling is in the neck, groin, and armpits, where the lymph nodes are. The second type is septicemic, when the organism is in the bloodstream. This type is almost always fatal. The third type is pneumonic, when the organism gets into the lungs. It's almost always fatal if not diagnosed and treated within 24 hours. Bacteria can break out of the buboes in bubonic type and cause the other types. The fatality rate, both historically and currently, for the bubonic type is 50 to 60% if left untreated. The other forms, 100% when left untreated. This is not just a problem of the past. Many countries are still affected today by the plague, including the United States. If you'll look to the picture, the gray areas are areas where bubonic plague are still seen today. Case fatality is still high and antimicrobial resistance has already begun. From 2010 to 2015, there were 3,248 cases globally, with 584 deaths. The current treatment is antibiotics and supportive care.
Over the years, there have been many things people have tried to do to eradicate the plague. The picture on the left is an example of the use of kettles, buckets, lanterns, and other equipment that was used to try and catch rats. This was done during the New Orleans plague epidemic that occurred from 1914 to 1920. The focus has now shifted from eradication to prevention. It is important to reduce rodent habitats by removing brush, rock piles, cluttered firewood, and any source of food supply that a rodent may use. This is important to do around homes, places where people work, and any area where people may gather, like a recreational area. Protect yourself from coming into contact with fleas by using flea repellent. This is important if traveling to areas with known plague cases or if taking part in outdoor activities like hiking or camping. Wear gloves if handling an animal that is potentially infected. Protect your animals from fleas. If your cat or dog roams freely in an area that is known to have the plague, do not allow those animals to sleep on your bed. These are common techniques used to try and prevent the plague. While eradication is currently not an option, prevention is the key.
So while there are several organizations that do deal with the bubonic plague, the World Health Organization and the Centers for Disease Control and Prevention are the most reliable information.
There have been many problems encountered with the plague. Some might think that there are no issues with the plague anymore, but that is not the case. Healthcare workers and health officials still have many barriers to overcome when trying to treat and stop the spread of the plague. In 2020, the Democratic Republic of the Congo faced problems while trying to treat and prevent the spread of the plague. A lack of resources was a huge problem. A lack of medication to treat patients, lack of personal protective equipment, a lack of body bags to bury the dead, and a lack of materials needed for decontamination hindered the treatment and support of those affected by the plague outbreak. A lack of available healthcare options would only make this problem worse. Other problems that may be encountered when dealing with the plague include a lack of early detection of infection because the plague may not be the first thing that comes to mind when diagnosing a sick patient. History has shown us that untreated plague cases can lead to death and the increased spread of the plague. With every epidemic, there are potential problems that unfortunately hinder treatment of the sick and affected.
Treatment of the plague is reliant on provider recognition of early symptoms. Standard precautions should be used for patients with the bubonic plague. Airborne precautions should be used for patients with pneumonic plague. Antibiotics should be available, especially doxycycline and ciprofloxacin. Other options would be gentamicin and levofloxacin. There needs to be plenty of testing supplies for laboratory testing. Staffing levels should be adequate, and fact sheets should be provided. With testing equipment, the rapid testing is less reliable. Medications such as oral fluoroquinolones have been approved by the FDA, and there is no vaccine that has been approved for use in the United States. The World Health Organization also has a readiness checklist that can be found in multiple languages. So while the bubonic plague has been the cause of the deadliest infectious disease outbreaks in history, it is still present today in certain areas of the world. Between 2010 and 2015, there were 3,248 cases of bubonic plague and over 584 deaths.